What's up, Sterile Processing Universe? It's Hank Balch here in studio with a fantastic discussion around the table on instrument repair. And I've got two instrument repair gurus with me today. The first of which is Michael Matthews. Welcome to the show, Mike.
Well, it feels really good to be here. I think we were talking earlier that we've never recorded together live. And so this is a first-time experience, and I got to tell you, it feels good, man. It feels really good.
Hey, welcome back.
All right.
Yeah, and, for those of y'all who can't smell Mike, he actually smells a lot better than he looks. So
I showered recently, so.
Justin, would you introduce yourself to the audience today?
Yes, I am the CEO and co-founder of Beyond Clean, along with Hank Balch. We've launched 3 other brands as well. First Case for the operating room, power supply for healthcare supply chain, and then transmission control for healthcare infection prevention. And so really excited to be here. I also am a registered nurse and have a background in instrument repair. So well suited for the conversation.
There you
today.
go.
And Mike, would you introduce yourself too?
Sure, absolutely. So I'm Michael Matthews. I am with Agility, who also sponsored this wonderful roundtable. I am the Director of Customer-Facing Training and Education, and I spent a lot of time as a SPD technician. We worked together as technicians and SPD manager for a while too. And so after managing, I made contact with Justin Poulin and got moved over to the vendor side because I get to do things like this, educate the public on things that we can do to improve the quality of our instrumentation. And that's what my passion is, and that's what I'm loving.
And we've got a lot to talk about on the panel, so we're going to jump right into the weeds. We're not even going to do the little dilly-dally around the side and then get warmed up. We're going to jump right into it.
We're going to get right into the heart of it?
That's right. That's what I was
All
going
right.
to say. Thanks, John. So let's start with all the different reasons that surgical instruments may need to be repaired and refurbished. And before you get that, can you define, is there a difference between repair and refurbished? Is that the same thing?
Yeah, it kind of is. I mean, when you talk about refurbishing, that tends to imply that you've done a lot more than just repair the immediate damage, like you're looking at a new device. And really, refurbishment tends to refer to devices because there's complex features, and usually what you're doing is replacing all of those things, right? Whereas repair is there's one thing that's broken and you're addressing that one thing. So there is a bit of a nuance to that, but when you talk about all the different ways that things could break, I mean, this is going to be an 8-hour-long video at that point.
But you got 5 minutes.
Yeah, exactly, right? So
Let's start with scissors and go categorically through.
yeah, let's try alphabetical. It really is. Some instruments are just damaged by necessity of their use, right? And so this is things like osteotomes. Osteotomes, they get beat against bone all day long. It's what their job is, and by virtue of doing their job, they get worn down. Scissors are like that too. All instruments will have some sort of normal wear and tear. But where we find most of the opportunity is from things that are breaking because of your processes. And, those are the things like...
it's my fault?
It could be. It could be.
It's the process fault?
Well, it just, again, it kind of depends
Okay,
on what
we'll
you're
dig into
doing.
that
Yeah,
later.
We'll
Okay.
get into
Okay.
that, yeah. But when you think about these things, seriously, it's like, what kind of condition are your instruments in when they come back from the OR? Have they been pre-cleaned? What's the condition of your water? Are there instruments sticking out of the baskets? Are things being mishandled in the OR? There's literally so many different sources, but if you did want to kind of put them into 2 big categories, one would be just normal wear and tear, the other one would be process-related issues.
So let's talk about lifespan of instruments next, because that is often a hot topic and I think potentially a confusing topic out there. Is there such a thing as an instrument lifespan?
So that's probably in the top 3 questions that I get asked. And the short answer is no. There is no lifespan of instrumentation. Now, there are some instruments that just over time, like scissors, if they have a sharp edge, they'll wear down. Every time you sharpen it, you're kind of shortening that blade just a little bit. And so it really becomes a tolerance level of, at what point is the blade too short to function anymore. So that kind of has a slightly predictable lifespan in terms of repairs. But for your other instruments like your hemostats or something, like they could last technically forever if you take care of them and there's no process issues. But the reality is that most instruments do break, and again, it goes back to that process issue.
And so there is a lifespan, but it's so fluid, it's hard to communicate that.
Honestly, they should be able to last, a lifetime.
Yeah.
And it all has to do with the type of instrument, like you said, sharps, obviously, because they have to be sharpened, and the more often they're used, the sooner they have to be sharpened. At some point, their lifespan does end. But when you talk about non-sharps, when you talk about retractors, anything else like that, really, if they're well taken care of, they should be able to last a very, very long time.
And I mean, we see this on the repair side, right? Like every facility has that one pair of hemostats that is like engraved and it says like 1968 on it, right? Like every facility has that phantom pair of hemostats that just has endured for decades, right? And why is that? Like what was so special about that instrument? Well, the reality is that it probably just didn't get mishandled. It was just lucky. Because yes, they absolutely can endure for an incredibly long time.
And quality of the instrument when you purchase up front matters too.
Sure, absolutely.
I mean, obviously, if we were talking about Pakistan instruments, then it's going to be a much shorter lifespan versus German grade. If you're buying floor grade instruments, you can almost assure that they're going to rust and corrode, if not after the first use, not too long afterwards, because they don't have the passivation layer. They're not designed to be in the operating room. So I guess in some ways we can qualify that and say surgical grade instruments that are German steel should last a lifetime. But there are obviously other ways to get instruments and instruments that shouldn't be in surgery that are not going to last that long.
Yeah, and they definitely won't last as long. Like even if you do have those process issues, which I mean every facility does, right? If you decide to skimp on the quality of your instruments, you're going to see them die a whole lot faster, even with that equal environment of the process issues. Another thing I like to tell people is that if you've been to one hospital, that means you've been to one hospital, right? Every hospital is different. Different hospitals have different process challenges, and those process challenges are what affects the lifespan of that instrumentation. So, I can't tell you what your facility's average lifespan of that instrument is going to be because your facility is different than every other facility in the country, right? And so there are unique challenges at your facility that are going to impact the lifespan of that instrument.
On that point, there's probably some towel clips out there, some adds and forceps that have a lifespan of a day or two because they end up in the trash after the first use, all the way up, to your point that you got mallets that have been there, for 50 or 60 years. But let's give some categories out there to the audience of in looking at their unique process, right? Because I hear you, like every process is different, every hospital is different. How would you approach that or encourage like departments to start digging into those failure points in their process that could lead? Like we've kind of referenced a few of them, but can you outline some of them specifically? I
mean, there's a number of processes that you can look at, like water quality, your point of use cleaning. Those are kind of like your two heavy hitters that you really want to look at very quickly. But one thing I like to tell people is, if you get your repair reports from your repair company, which any reputable company will give you repair reports at the end of the day that tells you, here's what we saw. Here's what we fixed. They'll usually have pictures. Ours have pictures of the damages that they see. And then a big one is the unrepairables, right? And so, if you are monitoring those repair reports and you're seeing that you get a lot of pitting, like that should narrow things down for you to really just point of use cleaning. Like that's your number one most likely cause. And again, like I think in sterile processing, we're doing a better job of getting data, but we're not really doing a great job currently with knowing what to do with that data. And it hurts me when I see, these repair reports just go into the trash, right? Because it's like you're just throwing gold away.
So you mentioned unrepairables.
Yep.
And I know as a sterile processing manager, I've had, various service providers for instrument repair. And I feel like that word has a different definition depending on who's using it. Can you give us a working definition?
Yeah, so our basic definition of unrepairable is this instrument cannot be returned to its original form and function, right? So in a way that is safe for patient care. And so there's a couple of different types of repairs that just automatically fit this category Pitting is one of them. A cracked box lock is another form of them, where there is no way to get that back to a condition that would be safe for patient care at that point.
And also, sometimes it's just that it's not cost effective.
Right, exactly.
So sometimes the amount of labor to bring it back to form and function that's safe for the patient just doesn't represent enough savings over the cost of new. And
or it could be a loss.
Or it could be a loss. I've definitely seen that where, a company will come in and offer to take a look at the non-repairables, but then, and they'll quote it and say, no, those are repairable.
Right.
But then if somebody at the hospital actually compares it to the cost of new, it doesn't make any sense. And you see that even with car insurance companies with cars. They'll total a car. It doesn't mean that the car can't be fixed. It's that it's cheaper for them to put the money out for their customer to buy a new car than it makes any sense for them to try to repair it.
Yeah, we've definitely have experience with more unscrupulous sales companies sometimes taking your unrepairables and acting like, oh, your other company's they're not doing things properly because these are repairable. And so they'll take like a cracked box lock and try to like weld it back together. And, that's obviously wrong for a number of reasons. And one is because to re-weld something like that, it's extremely expensive. And what's the point in spending $50 on a $12 new pair of hemostats, right? The other thing regarding that one is that obviously you can't guarantee that weld is as strong as the original metal forging. And so, again, like keeping track of knowing those more unscrupulous tricks will definitely help you spot people who are really just trying to manipulate things for your business.
Now, Justin, I know we had a great interview a number of seasons ago with David Ambari talking about the third party right to repair. And some of this is kind of getting to Mike's point, right, about there's a difference in quality out there. Not all third party repair providers are created equal. But if you were consulting with a hospital customer, what kind of questions would you encourage them to ask of their repair vendor to make sure that they're getting that level of quality that they deserve?
I mean, specifically around quality, I would want to know that they have ISO 13485.
Okay.
That's really the biggest thing. And a lot of that debate back when we spoke with David Ambari about the right to repair was centered around the FDA taking another look at that. The FDA did some really good things in the way that they began to evaluate the right to repair, and they started to categorize, like you talk about refurbishment. So they put repair into buckets that make more sense for what's actually being done. And so I thought they did a nice job of categorizing that. But another big thing that they're looking at is ISO. And that's the International Standards Organization. And a big reason that that's important is it's about quality management systems. And so, yes, you go through ISO audits, and it's basically making sure that not only do you have processes that are established, but part of that quality management system is knowing when something comes back that was not quality, how are you going to fix it? Do you have a process for putting in improvements? Can you continue to document that improvement over time? And in the past, a lot of the repair industry was a lot of small companies that didn't necessarily have quality management systems. That didn't mean that they didn't have qualified technicians or quality output. It just meant that there were so many different ones that it was really hard for the healthcare industry to get a handle on it. And a lot of what's happened is there's been conglomeration, there's been a big move towards ISO. And so I think for me, when it comes down to quality, the first step in that conversation is, do you have ISO 13485?
That's a good one. I would also ask about what is their training program look like for their repair technicians. Like you want to know that the guy in the van is not, was flipping burgers at McDonald's last week, right? Like what did he do to gain this knowledge? Because if you ever go out and talk to one of the repair techs, they're like artists. I mean, they really are. Like, this is an incredible skill set that they have. And a good quality training program will involve like a pretty lengthy apprenticeship under an experienced repair technician, right? So they're not just they're not just watching a few how-to videos and then being thrown in the truck like
on YouTube.
Yeah, exactly. But they're actually like being partnered with a tenured, experienced repair tech for months and sometimes. And that person is guiding them, watching them, correcting them. Like, you really kind of ask them what their training process is like, because you want to know what kind of training they've had.
I think
And that's not just on stainless, like you're talking about the van technicians, but there's also national repair centers. Another good thing to ask in terms of quality is how many different repair centers are there? Do they have some spread? Because, I think from a sustainability standpoint, and even as the healthcare industry learned prior to the pandemic, but even when the hurricanes hit Puerto Rico, it was a huge impact on the pharmaceutical industry. And so just knowing that you have that redundancy, but you also have centers of excellence, like sometimes redundancy does mean reduction in quality, but you need to be able to know that in the event of a natural disaster in one area of the country or another, that there's capacity to continue, to turn around good quality. But then there's this whole centers of excellence piece, so that maybe some of those national repair centers are, more focused on certain categories of repair. So, and there are multiple categories of repair as well. But, I think for the most part, that ISO is a good piece. What's the training? And even how do they continue to get assessed after that initial training? Like, how do they manage ongoing quality for field-based? To your point, you have much less control over field-based technicians than you do ones that are in the lab where everybody's working in the same environment.
Yeah.
Honestly, I think the new Beyond Clean micro credential would be a great addition to those technician repair and that education, particularly because it's connecting the dots outside of what's happening in the van. It really is connecting that whole surgical service kind of workflow from the instrument to the patient and back again. So we've got a tremendous amount of feedback. And what's great about the micro credential, I know selfish plug here, is there's no prerequisite. So like, you don't have to do time in the department. You don't have to have worked in healthcare previously. So it's really tailor-made for those kinds of vendors that are supporting the sterile processing service line. But, Justin, you brought up a great point. I've never considered, like, I've thought about that technician in the van piece. Are they quality? But then everything else is going off somewhere where I've never met these people. I don't know anything about them. I don't know what they know or, how good if they are at their jobs. And I guess that's where that ISO piece comes in, because that's the safety net for what's happening.
And quality of service doesn't always mean just the actual repair itself. Quality in terms of contractual obligations means turnaround times. It means loaner availability. It means coordinating. And sometimes not just the field-based service folks, and they do communicate with the internal labs and they gather information, but somebody's got to connect the customer to those people. Like you said, you don't have a personal relationship with them for you to have trust on the national repair centers or those off-site, repair centers. You're very disconnected from that. Honestly, the sales representative that's supporting that service for your organization from field, and whether they're picking up and just shipping in, devices for repair, or they're involved with some sort of a repair technician that's on site, either way, it really does matter that sales representative's ability to communicate what's the complaint on the device back to the lab. You really want to have that, and then bring that information back, because if there's opportunities to educate the surgeon or anybody around improper processes like Mike is talking about, the sales rep needs to be able to understand that feedback from the lab and almost translate it into what the field looks like. So when you talk about the micro credential, that communication doesn't flow really well unless the people that are involved in serving that customer really understand the sterile processing department and the bigger picture.
Yeah, a lot of it is just learning to speak the same languages, right? Learning how to communicate between those groups. Back to our original discussion, though, what are some other things that you would be looking for in a repair company? Transparency is another big one too, right? Like, what data are you giving me about what is actually being done? That transparency factor there, when it comes to especially repairs, like, there's so much room for manipulation. And the more transparent you can get, the better you're going to get, the better insights you're going to get, number one, for action, but the more protected you're going to be from things that can be manipulated.
Let's talk next about the state of the repair industry. I know we talked about like the regulatory impact of the FDA and everything else, but in general, Mike, when you're in these facilities around the U.S., what level of quality or consistency in the repairs are you seeing? Like, are we above average? Do we have some blind spots? Kind of talk us through that.
Yeah, when it comes to hospitals, I feel like most of the larger hospitals are doing a better job at moving away from that reactive repair into the more proactive repair. And the reactive repair, obviously, like that's a bad thing. I think most of the time they move to what we would call a time-based repair program, which that's better. I don't think that's best, right? So we're kind of in this, we're making some progress. We could still make some more progress. And that best is utilizing your data to get to a usage-based repair. Now, I say that for larger hospitals. I do think that in smaller facilities, especially like rural facilities, or especially in ASCs, we do still see a pretty decent amount of that just reactive approach. So we don't know it's broken until the OR tells us it's broken.
Right. And it's kind of like if it's in the box, it gets repaired. If it's not in the box, no one ever sees it. And to your earlier point, that doesn't seem like a very good plan for hardwiring quality.
No, not at all. And it's really, I mean, what it really gets down to is patient safety, right? And if you just put yourself in the position of the patient, so it's you on the table or it's a loved one that's on the table, like what would you expect from the instrument functionality? And you would expect that every single pair of those scissors is cutting tissue perfectly. You would expect that every single one of those needle holders is not going to break off their tungsten carbide inserts.
How many people think that the instruments that are used on them in surgery, if they're from general public, are all brand new instruments?
Absolutely. Actually,
they aren't even aware of reprocessing.
No, when I started doing sterile processing, I told my father-in-law what I was going to be doing, and he said, "Wow, I thought all the instruments were disposable." But that's the general public, and that's their awareness level. So they just assume this, right? But those of us on the inside, we have the insider information, and I guarantee you that if you were to be honest with yourself and you were to say, a loved one is going into the hospital tomorrow at your facility, you know which technician you would want to be in that case, and you would know which instrument sets you want pulled for that case, right? And what that means is that you've got an uneven level of quality in that. And so, yes, there's a tremendous amount of patient risk, and I think we haven't done a good job of explaining what that risk is. And so when we think about instruments breaking during surgery, like that's a massive risk to patient care. If you think about scissors that aren't cutting cleanly, but instead they're crushing tissue, like that's extra damage to that wound bed, and extra damage to the wound bed means less blood flow to that wound site as it heals after the surgery. Less blood flow means slower healing, and it means more opportunity for those surgical site infections, especially anaerobic bacteria, to get a foothold. So like what we're talking about here is not just trying to keep the OR from complaining. Like we really are talking about legitimate patient safety issues.
I know Dr. Wava Truscott has had a lot of conversations on the podcast and at our education sessions about the impact of that. And even on the consulting side of things, like I've talked to a number of hospitals on site, and they kind of get an instrument and they say, hey, how much rust is too much?
Yeah.
And my answer...
Or pitting. I hear that too.
Yeah. So
how
my
much
answer
pitting
is
too
always,
much?
well, if you wouldn't want a photo of this instrument on the front page of your community newspaper, then it's probably too much. That's reality. And if you wouldn't want it used on you or your family members, that's too much. And it goes back, honestly, to this big, tape debate in the industry that I know, like repair providers have been a huge help and getting that tape removed, that's like an emergency call of, hey, we just got cited. They'll be back next week. Can you go remove it?
Yeah, we've done several of those calls, and we can help you if you're in that situation. So yes, we've done it, and but I think we can all agree that preventing that from happening in the first place is better.
Yeah,
Because it goes back
tape
to the
in
fitting.
itself is not a bad thing.
Right.
It's the fact that it's an insurmountable maintenance job, especially like because the technicians are not going to be able to do it.
Yeah.
So the
Yeah, if you're not
repair
given the
company
time
can
or the
do it.
resources.
That's right. That's
Right.
exactly right. And so it's not tape; it's tape in poor condition. And the Joint Commission has been focusing on this for the last several years. And as a result, you see a lot of facilities trying to move entirely away from tape. And I don't think that's a bad choice whatsoever. I think, honestly, it would be better to not have the tape overall. I think there are some scenarios where tape probably still has its place, but ultimately, the more we adopt instrument tracking systems, the more, laser etching,
Right.
for those instrument sets to help them get assembled. The reason that there's tape is because people are concerned that they're not going to get the right instruments in the procedure, and there's going to be case delays. And so that's a cost, to the hospital for not having the right instruments at the right time for the right patient. And those things matter in their considerations. But with technology, we're definitely capable of accomplishing the same goal, without an infection risk. And so everybody should be trying to move in that direction.
Yeah, that what you just described was kind of tape at its worst.
Right.
And I actually worked at a facility that had kind of this system in place where you didn't have to actually know what instruments go into a minor set. You just needed to put all the red instruments together, right? And so it was like a shortcut to actually learning the instrument names and what their parameters were and all this sort of stuff. And so, yeah, that was kind of like the ultimate worst. And the biggest, there are many downsides to that, but the biggest from a patient safety standpoint that you're just describing is that if you've ever replaced the tape on a single instrument, it is a time-consuming process.
Yeah.
Now, multiply that over by 80 instruments in a single set, right? Like you're talking about investment of potentially hours to retape a single set.
If you say, we want the repair company to remove the tape for us, the repair company is more than happy to do that. If you say, we want the repair company to remove the tape and reapply new tape, then the repair technician goes like this.
Yeah, that time spend goes up quite a ways.
And it's the same thing in the department, though. The technicians don't want to be applying tape.
They're not
Name
going
a
to.
technician who's like, oh, I can't wait to tape this new set of instruments.
Yeah, they're not going to, and that's just the reality is that if you've got the OR yelling at you to hurry up and get that instrument set ready, you just don't have the option of saying, hang on a second while I retape the entire thing.
Right.
Like that's just not going to happen. And so, like tape is a serious concern now. I mean, I do feel like we do have to recognize that according to ST79, it is still acceptable, assuming that it's in good condition, and that's the key phrase.
That's the catcher.
That it has to be
because
in
they
good
start
condition.
poking around in labor and delivery, and the next thing you know, you're in trouble.
Which I can tell you, I mean, from experiencing this, like those labor and delivery nurses, God love them, but they remember when 1988 they had this huge rush of 30 babies come in that door, and they live in perpetual fear that every day is going to be that day in 1980. And so,
Traditional point of use educational department needing education as well. Lots of blood, usually not in the normal circle of surgical services. They're oftentimes in a different department, so it's not getting back. Blood dry, like it is a very common challenge, which that in itself is a risk to the instruments, but even as it relates to tape, it's also a challenge to maintain.
They degrade very quickly, and then how often do you see them to reapply? And so, yeah, you're right. Like it is a process that is fraught with a lot of struggle and a lot of risk. And so, again, I have to say, like technically, according to the standards, it's okay, but boy, there's a lot of risk that goes with it.
Which department usually asks for tape?
Labor and delivery.
Right.
Yeah.
So to get us back maybe on track from the tape discussion, very valuable.
You started
and instructive.
it.
I did.
You
It's
started
my fault. And it's a good microcosm of the process fix. Like tape is trying to fix a process that's not good to begin with. To your point, Mike, it'd be better suited for tracking and for like a technology solution rather than a product solution. But speaking of technology, you also brought up the time-related versus usage related. And I really want to spend some time to dive into that because I know it's one of Justin's favorite conversations to have, and we've done it before on the podcast, but it's still worth talking about again in this context. What is usage-based repair, and why is that such a unique and beneficial way to approach how you're kind of monitoring this repair process?
Sure. So, I mean, we'll start with just what is time-based, right? And time-based is what we see most facilities using, which is, hey, every 6 months, our instrument sets go out for repair. So all the instruments are kind of on this rotation of they're getting seen about once every 6 months. But what the flaw in that logic is that not all instruments need the same level of care, right? So an orthopedic mallet does not need the same amount of care or frequency of repair as a micro instrument set that's used in eye surgery.
Delicates need more care.
Yeah, absolutely, right. And so, yes, you can kind of adjust that your time-based system to say, okay, well, we'll send the micros out every 3 months then. But the reality is that you still don't have a good grasp on how many times is that instrument set actually going through the process, because again, the process is what leads to the damage.
And when you say that set, we're not talking set type.
Correct.
We're talking set number or unique set. So if you have a whole bunch of micro sets, right, there's 10 of one type, then set number 2 doesn't necessarily get used as on the same rate or as often as set number 10, because set number 2 might be sitting in front. That's the one that gets pulled every time. It gets seen, 40 times in 3 months, whereas another one only gets used 10. And there's really no way to evaluate the quality of the program.
Because we know when scrub techs are pulling cases, they look at the expiration dates on each of them and they compare to make sure that they're getting the one closest, right? Like we know.
Is that what they do?
Yeah, we know that's happening right now. Of course not. They grab whichever one is closest. And so to your point, there will be like 3 or 4 sets that get used a whole bunch, and then maybe like 2 sets that rarely ever get used. Well, they don't need to be repaired every 6 months, right? The 2 that haven't been used, they
don't need to be repaired.
Yeah, they probably don't need to be repaired at all.
They weren't used. They don't need to be repaired.
Yeah, so it's like...
But they still get pulled, and there's a cost to the department.
Exactly.
Because once it goes out of the department, even for just an inspection, if there's no repairs, that still has to come back in to the dirty side. It's got to be reprocessed. It's got to go through
it's a wasted process for you.
Sterilization, and that all comes with a cost. Not just a wasted process, though, for the department. It's also inefficient for the repair company.
True.
Why do they want to continue to see sets that don't need to be seen? It takes up a lot of time, doesn't create billing, it's inefficient. It decreases their profit model, and it increases cost loss for the hospital.
Yeah.
That's not good for either party.
Right.
In a partnership, you would want an effective program to be able to manage repairs, so you're seeing these sets exactly when they need to be seen, so that it's great for everybody.
Yeah.
And so let's bring it out of the clouds into the weeds, maybe, or maybe not all the way into the weeds, practical.
Be careful what you wish for.
Yeah. So Justin, if a department is sitting out there thinking, I've never really liked my time-based, I didn't really know what was wrong with it, but like something just wasn't setting right, and they're listening to this and saying, oh, that's what it is. And now they're convinced, what's that kind of basic next step to move from that time to usage-based repair?
You got to have a tracking system. I mean, one of the benefits of having a tracking system is now the customer owns the data. Typically in a time-based rotation, 99 out of 100, if not 999 out of 1,000 times, the repair company is managing the time-based program on a spreadsheet. They may be sharing that with the department manager or whoever the supervisor is that sort of oversees the repair program, however that's set up. Sometimes it's the educator, but they may be sharing that data, but it's not the same as having your own information in a tracking system. There's no way to know how many times a set's used unless you have a tracking system that is scanning the set every time it goes to the case card or every time it goes to prep and pack. I mean, there's a point in the process where it gets a count. Typically, I'll see it in prep and pack or at the sterilizer. And so that's where the usage starts to get calculated. And from that point on, now you can set them out so that they're all seen equally. But you're going to need somebody to set up the usage frequencies in the tracking system to build the program. Which ones do you want your repair company managing? which ones are loaner and consignment that shouldn't be part of that program. So there is some setup. The starting point out, if you don't have a tracking system, you can't do usage based.
Yeah, there's really just not unless you keep like a tally on like each individual set and like that's not going to work.
Not
all the time.
feasible.
So, yeah, so-
If there's someone out there who does not have a tracking system, is stuck with time-based, then what's the best they can do with time-based? Because I'm assuming like not all time-based are created equal as well. Like, do you have any like recommendations on how to make the best of a bad case scenario?
Yeah, so I mean, like you can keep track of what is actually being repaired. And so if you see that this instrument set goes out at 6 months and what we get back from it is 50% of the instruments are damaged, right? And like, okay, that lets me know I probably need to up that frequency a little bit because that means 50% of the instruments in this instrument set weren't really qualified for patient use. They were being used on patients, but they weren't really supposed to be used on patients, right? And our goal is to get those things out before they happen to the patient. So again, like monitoring how much is being repaired will kind of help you fine tune that frequency a little bit. Again, it's not going to be anywhere close to as accurate as usage based, but you can kind of use your repair ports to get a feel for what's best.
I know this is kind of in the weeds question, but for containers, rigid containers, what's your recommendation on how to keep track of those? I know
Service them the
sometimes-
same on the same schedule. When they
Are they tied
send
to
them out,
the tray though? Because
the
they're not
containers
always.
themselves, no,
Right.
but honestly, you're not going to put them on a usage-based rotation.
Okay.
A lot of the damage that would happen to a container is going to be more event-related anyway.
Okay.
So, you can set up, just like you do a repair bin, you can set up a rack where an obviously damaged container lid or container goes on the rack
And
so that it
happens
goes
at
out
the
for
assembly
service.
areas where that's
But the
what we
repair
find.
technician, when they pull trays out for service, should be checking the gaskets, making sure that the container lid fits snugly and securely, that all the locks are working properly, that the springs aren't broken, all of that. So it should just be part of their inspection process, provided that they have that category of repair with the customer. Sometimes there are other service options, like the original manufacturer has repairs at no charge. So then you might have a repair technician that identifies ones that are in need of repair when it's coming out. That doesn't necessarily mean that they're repairing it, but they can still bring that information forward to the customer and say, hey, listen, this needs to be repaired.
I mean, in terms of going back to the way original question about what's the state of instrument repair, that is kind of something that I've noticed is that the number of times when I talk about the containers themselves, the number of technicians that are like, oh yeah, we haven't sent those out. Like apparently it's been it's a common practice.
Totally left out of the equation in most cases.
And I think what's going on is that they are knowledgeable about whatever they send out for repair has to come back through reprocessing, right? And so if you just take the instrument basket out, you don't have to rewash the containers anymore, right? So it seems like a process fix or to kind of limit the amount of stuff you're having to redo. But the reality is that those sterilization containers can fail, and when they do, it is a massive risk to patient safety, right? So I mean, if that spring isn't holding that latch properly, as soon as that instrument set comes out of the sterilizer, it's exposed to outside air, and the OR is going to use that, and it's not safe for patient care.
It's still not a good way to transport. That was always my reason for discouraging customers, to only send out the basket, because they're leaving the building, right? And they're going on a cart, and sometimes
open
it's
basket.
bumpy and it's open basket. So, would you advise the operating room to transport the instruments back to decon in an open basket? Or would you want it in the container so that they weren't falling out and all over the place, even if they got jostled up a little bit?
Yeah.
I also just think it's the best way to transport instruments. But to your point, lots of people just take out the basket and not understand the reason for it.
Yeah.
I still think, this is personal opinion, best practice is to send the entire tray out.
Yeah, just send the container with the basket.
Yeah.
Absolutely.
It's definitely a gap in that data piece because those containers, for the most part, are not serialized. And so, you can have that migration of containers if you're not tying containers to trays, which I know that some people do, right? So, like, if that's the case, then you are going to capture them all on that schedule, like what you're saying, Justin. But yeah, definitely, even in maybe the next update to the AAMI guidelines, it would be helpful to get some direction on how these external transport of trays need to happen, in that repair context, because it's happening every single day at facilities all around the country.
Yeah, there's a working group working on that right now. Actually.
Oh, really?
Yep.
Okay.
Yep.
Look at
I
that.
should be involved in that.
Well, you should join.
Yeah.
So let's talk about the documentation piece of this, because in healthcare, if you didn't document it, it didn't happen. And you mentioned earlier is like one of the best practices or one of the tips that you should be expecting from your repair vendor are those end-of-day reports. What other kind of documentation should users be keeping, or should the repair technician be aware of in this whole instrument repair question?
Yeah, so things that you want to keep track of within that, repair report, like you want to know how many unrepairables you have. You want to keep track of what was unrepairable about them. Was it things like pitting? Like pitting is kind of your big one that you really want to pay close attention to, because like if you've got pitting, you know that you have a process problem and it's probably point of use care. And another thing you want to keep track of is probably, instead of just an end of day report, but Justin, I know you're a big believer in the quarterly business review,
Absolutely.
where you can kind of look
Big
at
time.
a larger set of data.
It's my thing.
Yeah,
That and usage-based repair.
Yeah,
It's like he's got a little pillowcase that says usage-based repair,
Yeah.
and they flip it over, you got quarterly business reviews.
yeah. I mean, but it makes sense, right? Because I mean, it's one of those things where, to your point, sometimes it is hard to see the details when you're in the weeds. And what a QBR does, a quarterly business review does, is it kind of pulls you back and say, okay, let's look at the general trends.
Yeah, I think there's 4 key components, right? So you want to see trending. So you talked about unrepairables. You also want to know percentage of repair.
Yep.
And you want to make sure that that's moving the way you expected it to towards a preventive or proactive repair model. If there's opportunities, for improvement, that should be in there. So I think that trending really should have some actionable insights that are attached to it. If we're not seeing the trend going in the right way, if we're seeing damages that are preventable damages and not normal wear and tear, there should be some examples in the form of pictures to help the customer realize that. You should be looking for teaching and educational opportunities to increase awareness, not only amongst sterile processing, but the end users, the team leads in the OR, the surgeons, if you can meet with the physicians, even just to talk about the program or make your repair technician available, to the physician. I think them explaining, how the instrument works, from more of a functional standpoint and how the repair works, sometimes you can solve some problems there too. But at the end of the day, trending, actionable insights should always be some successes. The customer wants to know that you're taking them on this journey. This isn't something that you just establish as a program, and once you've got everything in the tracking system and you set everything up, you just let go of it. Because if you're getting negative feedback from the OR and it's not preventable damage, you need to adjust frequencies and usage.
Yep.
If it is preventable damage and you're getting feedback from the OR and you do an assessment, then you need to educate them.
Right.
And then that's really where the opportunities for improvement, comes as really a 4th key of a QBR. And with the opportunities for improvement, the repair company should also be transparent. This is the area where we think we need to improve. If this is just simply a one-sided conversation on the QBR and it's like an attack on the customer and why they're not doing what they should be doing, the repair company needs to look and say, this strategy works usually, but I really feel like we need to do something a little bit different to support you here. So we're going to make this change on our end as an opportunity to improve the quality of the program for both of us.
Yeah, and that could be, just for example, that could be, hey, there's this one instrument set that we just cannot ever seem to get our hands on. And the reason is because that's Dr. So-and-so's day to do surgery, right? So what we're going to do is, once a month, we're going to come on a different day, so that we can actually get our hands on that set, right? So perfect opportunity to be that partner for the customer and, help them address those issues. One that, you hit on my pet topic that I love to talk about, which is the use of pictures, right? The digital microscopes. And so that would be another thing that I would want to talk to my repair company about, is like, what kind of pictures can I expect, right? Because those pictures can really give you a lot of detailed information about what is potentially breaking on that.
And they're
instrument.
proof.
And they're, absolutely. they're proof.
I've done a lot of educational presentations where I have stock photos, and then the customer is like, yeah, but that doesn't happen here. And we all know it does, right?
Yeah.
But when you share pictures of their instruments,
right,
then it's sort of, okay, well, I guess they can still say, well, that was one instrument. It's usually not like that.
Right.
But at the end of the day, it's just a different level of ownership, which creates a different level of accountability, which ultimately, if it's approached the right way, can be a bonding, partnership, alignment conversation that can be very constructive. You know, as long as you're not attacking the customer as a repair vendor, and as the customer, as long as you feel like you can do something about it. I'd say maybe you want to talk about this, Mike or Hank, you know, having been in a department when a repair vendor comes to you with something that they truly can't control, that's feedback for the department, and you as the manager are like, I know this is an issue.
Right.
I've been talking about it forever. There's nothing I can do about it. My hands are tied. That can be a very frustrating type of experience. I always say to the vendor, I mean, as training a sales representative or talking to a repair technician, I always say, you've got to explore where the pushback is. Can you step up another, you know, move forward with those pictures, et cetera, to really empower that manager to make that case, that business case.
I mean, make it into a video.
Right,
Yeah.
absolutely.
Yeah. And if you do that, if you help that manager get something through that they've wanted to get through, like, you become a whole lot more than just a vendor to them.
What better way to establish trust?
Yeah.
Now, Justin, you mentioned the term ownership, and it actually kind of transitions to a follow-up question here that Mike brought up, and it's access to trays. Because you can have the best, you know, usage-based repair program that everybody knows what trays are due.
I love that you're going here with this question.
But it's incumbent still upon the frontline technician and the department leader to enable that access, you know, based on the data, to make sure that they make it as easy as possible for you guys to do your job. Can you give any insight or encouragement or anything that you want on like how to make that the most effective collaboration?
It's not just ownership, it also ties to the trust piece.
Yeah.
Because, you know, what the sterile processing department doesn't need is more work to do. And a lot of times you'll find that they're pulling the trays, but then if they're pulling the trays, they're not always pulling the right ones. They're only pulling what's available. They're rushed. They're just trying to get you enough to get started. It's not even a full day's worth of work. And you want to establish the trust to be able to get those trays as the repair technician and pull them out, so then you take the ownership or the accountability. But without trust or a process that builds trust, it's a no-go. So typically what I'll say to repair technicians is just say, you know, let's establish a process where I do all the legwork and go find the trays. I'll never take the last one or the last two, you know, depending on how the facility wants you to approach it. But I'll always leave one or two on the shelf, so you can trust me to do that. And then I will bring these trays to a supervisor or some designated individual and just review them, knowing that you have more insight into the case schedule. And some repair technicians are going to be better at looking at the surgery schedule and making a good judgment. But at the end of the day, before we go, or at the beginning of the day, before we go out to the repair vehicle, we're going to check in with you and make sure it's okay to take these. Now it doesn't take them time, and if there's a specific tray number that needs to be sought out, the repair technician is going to have more time to do that, knowing that quality and how they're perceived and experienced by the customer is more important to them than maybe a technician who's been given this list and told, go find these trays, and they give up because they're getting pulled in a bunch of different directions.
Yeah, absolutely.
Another random kind of curveball question, what I think is important anytime that you talk about instrument repair, are these repair bins. Give us some best practices about, you know, what those are good for and what you should be aware of in creating your repair bin process.
Yeah, so the thing I like to point out about the repair bin is that just because an instrument is broken does not mean that the maximal amount of damage has been done to that instrument, right? So like if you've got a pair of scissors that just has like a little bit of a dull spot in it and you throw it in the repair bin and the next thing after that is a giant mallet, you know, like, and all of a sudden, like now your scissor looks like this. Yeah, don't assume that just because it's broken that it is damaged to the extreme, right? Like you may have just turned
You almost need a repair bin for the delicates.
Yeah, absolutely.
And sharps and another repair. And I never even thought of that. That's a really fantastic point.
Yeah,
man.
I mean, because I know, like when I was doing some territory manager work for Northfield, which was acquired by Agility, like I would go and look at a repair bin, and sometimes like you'd find like a rigid scope in there. It's like a rigid scope, and then also like a power hand piece, and then a mallet, and and it's like you probably had one broken rod lens in that rigid scope, and because you threw all that other stuff on top of it, now it's a complete rebuild.
Right.
And going back to the data piece too, and that's kind of where my mind goes all the time with that is in your scanning process, instead of just taking out that damaged instrument, then putting it and then replacing it, to have a scan at the point of processing that tells your system this is taken out for damage. It's just another one of those like documentation steps that then you can now cross-reference. Oh, I scanned out 6 scissors last week, all for damage, but there's only 5 in that tray. Where did the other one go?
Yep.
Is it back in a tray somewhere? Like there's all those kinds of steps that can be captured at a very easy scan that can give a lot more transparency to what's going on in your inventory.
Yeah, that's a whole other level, that instrument level, tracking and scanning. And I'd say just about most of the facilities are just nowhere near that. But even on a larger, higher level with that, just knowing what trays are at the repair vehicle, should there be a need with the tracking system, that it was scanned out. Because just because you checked in with somebody, especially in that time-based model, just because you checked in with somebody before you took the trays out for service doesn't mean that everybody else in the department knows where it went.
Sure.
And if there's an issue with one of the trays, and the site, all of a sudden there was add-ons that nobody was aware of, and they approved them to go out, then there's nothing on the shelf. They don't even know where the inventory is.
Yeah.
The tracking system, if scanning out for repair, would give you that insight.
Yeah, absolutely.
Let's talk about backup inventory, backup wall. Just like containers, I see that as a pretty massive gap in repair because, again, they're not associated with the tray. They're not going to be on any regular intervals. It kind of goes back to what you're saying, Justin. They're not being scanned down to an instrument level. So as we're replacing, scissors, clamps, forceps in our trays, the system's telling you that, hey, this tray is due, based on usage, but it may have a brand new scissor that was taken off of the backup inventory wall, or it may have a scissor that's been used 20 times more than what the system tells you because it's not scanned to the tray. Is there any best practice around tackling that backup inventory to make sure that it's always as prepared to go in trays as the rest of your items?
Yeah, I mean, a very important fact around backup inventory is that people think that because it's on the backup board, that means it's in good condition. So many times, instruments not in good condition, instead of making it to the repair bin,
Just get put on
get put on the backup board.
Okay.
So the thing that you want to avoid is you pull out a bad instrument from the tray as you're inspecting it. You're putting that bad instrument in the repair bin, but then you're just grabbing something off the backup board and putting it in as a replacement. That doesn't mean you definitely need to be inspecting that as a sterile processing technician. I also think it's good best practice for the repair company either once or twice a year to go and inspect the backup board and pull off instruments that are in need of repair and service those on a regular basis as just a checks and balances, or that extra level of hands-on and inspection. And
you could just say the same thing about the peel pack wall.
Yeah, great point.
Absolutely.
So
That's where my mind was going, actually.
Yeah, they aren't really tracked in that way either. So yeah, I think the peel pack wall, exactly, and of course, your repair company will hopefully be helping you with that as well.
We've got about 7 minutes left here, and I want to spend a couple of minutes here just on communication strategy, specifically to the operating room. Like we've talked a lot about the technician interfacing with sterile processing, but from a sterile processing kind of leadership perspective, and then also from the repair vendor perspective, what are some best practices in ensuring that all the information that we're talking about today is getting communicated to the end user and back on a regular basis?
Yeah, so obviously having a great conversation, having that great relationship with your repair tech is critically important to really bring them into the process. Justin earlier mentioned that you can even communicate with the physician regarding with your repair tech. So if you've got a physician who is not satisfied with the way an instrument is being repaired, don't panic. Just ask. You can ask your repair tech to go have a conversation with the physician themselves, right? You may find out that there's like a certain angle the physician cuts at, and it needs to be sharpened in this particular angle. Like that's a fixable problem. And if you're viewing that repair technician as part of the team, even though they don't report to you, but they are part of your process, you can have a higher level of that communication. I mean, another thing is that that repair technician is probably going to have a lot of insight just from their experience on what is actually going on with your instruments, right? Like they're going to notice those trends, and a lot of times they'll be the first ones to alert you that, hey, we're seeing a lot of scissors that are all of a sudden dull, and you find out that you've got a new surgeon or something like that who's using them improperly, or you've got new technicians who aren't stringing them properly, like whatever. But like they'll be the ones who will tell you like, hey, I saw a lot of blank.
Right.
I just think it's critically important to engage the team leads. A lot of times the best opportunity to gain that relationship and that trust is when you are setting up a preventive maintenance program, because then which sets are giving you the most trouble? Which ones do you get the most complaints about from the surgeon?
Team leads in the OR.
Team leads in the OR, so that you're getting that end user feedback as you're beginning to establish what is the usage frequency going to be. It's also the best way to funnel feedback around preventable repairs or damages, I should say, that are leading into excessive repairs. It's a lot easier to go to somebody you have a relationship with and say, listen, I saw this double action rongeur. It's got this big cutout. Yeah. It was probably used to cut a pin, and you have a pin cutter in the set, or you don't have a pin cutter in the set, and we should get one in there.
Yeah.
Right.
But those conversations go a lot smoother when you already have a relationship and you have buy-in. I think if you're going to them and setting up a proactive repair program, or let's say you already have one set up, but the team leads were never involved, going and educating them that this is how we take your feedback and improve the process. We have bi-directional communication. It's all focused on quality. I just want you to know who you can call, and then we will become accountable for trying to help you get the most out of this repair program. And so that's the key, I think, is getting them involved.
Yeah, and what a great way to communicate to those key personnel that like you're taking their experience of using the instruments seriously, right?
How much of that doesn't even actually get to the repair technician?
Yeah.
Because it goes through this game of literal telephone.
Yeah.
Maybe broken.
Yeah.
Right? Well, maybe when you inspect it or didn't work right, or surgeon said it was dull, and then you look at it and it's not dull. And there are all these things that can come up in that chain of communication. By the time it reaches the repair technician, they may not be getting accurate reporting on what's going on.
Yeah, and again, that's just a way of telling those leads that, like, number one, we take your feedback seriously. Number two, we're thinking about how this performs for you during the procedure, and we're thinking about the patient, right? And you can communicate all of that just by simply having a conversation with those leads, or even with the physicians directly, if that's an option.
I do want to add one thing that's not quite related to this conversation, but it's really important as it comes to just any kind of preventive repair program in general. When you put them on a rotation, duplicate trays are the biggest enemy of quality. And so if you've got two number twos, it doesn't matter if you're time related, it doesn't matter if you're usage based. If you pulled one of the number twos, repaired it, and it's on the list that it's been repaired, and then the other number two that got neglected ends up in the OR, and the surgeon complains, and then they look at that log and they see that you saw it 2 days ago, they are immediately going to look at the repair company and say, what is going on? You just repaired this? They're going to start to call into question quality. I don't know if it matters as much to the sterile processing department leadership, supervisors, technicians, et cetera, about duplicate trays, but I promise you it matters greatly to the repair company, even if the technician doesn't know that it matters that much.
Yeah. Well,
Quality experience.
it matters to the
huge.
patient safety too, right?
does.
Because that means that set hasn't been seen, and now it's in a reactive repair situation.
Great
right?
point.
So,
It matters to the patient.
yeah, it matters to that patient, and so again, like you may look at that inventory number and say, well, who cares? It's a set. But the reality is that it does have impact on multiple different things when it comes to tracking and then preventing that from getting to a patient.
Well, guys, time has flown by.
You
with
sure you
us
don't want to do another
today.
hour?
Yeah.
Round 3
We're
is
just getting
coming up
started.
next. Yeah.
Just want to ask the future looking.
Oh, yes. Yeah. So let's wrap with one more question here on the future of the industry. We actually like to ask this on all of our podcast interviews. Is what does the next 5-10 years look like in this space? What should we be expecting from instrument?
Yeah, so this one's an interesting one because we've already talked about the data piece, right? And we're all big believers in data, and we don't need to repeat that's going to become a bigger deal. But one thing that I'm beginning to see more frequently is the use of an in-house repair lab. So instead of having a van on site, you have an actual room in your facility where all of the repairs can take place. And I can say we've got a handful of these across the country, and in every single place where they are implemented, they are incredibly well received because it just tightens that turnaround time. If you've got like that one pair of scissors that Dr. So-and-so can't live without, and you need to hand them off and immediately get them back that day, like you can do that. If you've got that one critical piece of instrument that needs to be repaired prior to the next case, you can run it down and do that. And of course, again, when you talk about trying to increase that transparency, increase that communication, like what's better than having that instrument repair expert in your facility at all times and accessible. So in the places that have done it, it's been wildly successful, and I think we're going to see a continuing trend of more and more of those in-house repair labs.
I think that would make a great podcast down the road, Justin, on just what does that dynamic
In-house
look like,
repair
what are the
labs, setting
impacts?
them up, how do they work, what's the benefits? Absolutely.
I would listen to that.
Yeah. Well, we have already set up our next conversation out of this conversation. Mike, thank you so much for your time today.
My pleasure.
Nice job.
Yeah, I enjoy it. Love it.
And if you're tuning in, all the CE links, not only for this live stream, but also for the bonus content from Agility U on care and handling of surgical instruments is also going to be linked below. So make sure and check that out. Thank you for tuning in and spending your valuable time to learn about the valuable discussion of instrument repair. And until next time, keep fighting dirty.